So we are live. Hi everyone, my name is Ria Rustagi. I am the co-founder of a startup called Neuphony in Munich, and we are developing a wearable device which validates your mental health. So it uses neurofeedback as a technology to track your brain activity and then recommend meditation techniques to you based on the desired state. As a part of our startup, every week we have people from the neuroscience, psychology, and mental health background to come and share their journey and their expertise. We also have people who have gone through depression, anxiety, and stress and how they dealt with it in the past years. Today, I have Elliot Brown with me from Berlin. He's a clinical neuroscientist who's been in this field for almost 12 years now, and his expertise lies in psychology and mental health research. Welcome, Elliot, to our platform.
Thanks very much for having me. It's a pleasure to be here.
It's a pleasure for me as well. So, is there anything you want to share with our audience about yourself? Why neuroscience? Why mental health?
Yeah, sure. I guess what you explained, the kind of people that you've been looking for, I would feel tick a lot of those boxes because my background is really in neuroscience, but a lot of what I've been working on is also in the psychology realm. But I've always really been focused on mental health, and I've also experienced mental health problems myself and
Oh.
had to deal with those. And I've been through therapy. And I'm still taking medication right now, actually, and still having therapy. So yeah, I feel like I tick several of those boxes of what you're looking for.
Oh
So yeah, I
wow.
hope I can share
Can
several
you
different
share something?
perspectives.
I actually had no idea that you yourself had
Yeah,
struggles with this. Can you share something about
sure.
your journey?
Yeah, sure. So I've had a handful of depressive episodes over my life. The first one was probably in my early 20s, I'd say. And then I kind of managed to cope with it on my own. Like I didn't seek any professional help at that time. And then I had a couple more kind of mild episodes, which I also managed to cope with on my own. And it wasn't until 2 years ago that I really had a much more severe episode, and I even ended up in hospital. And it was actually on the first birthday, my daughter's first birthday. And it was the cause was like a combination of lots of different things, a lot of things associated with being a new parent, and also, just really like neglecting taking care of myself. I took 7 months of parental leave, um, and I also quit smoking cigarettes at that same time, which I think had contributed a lot to my mood. And yeah, since then I've been getting a lot better. And yeah, I used to live in Canada, and I moved back to Germany. Well, I'm from the UK actually, but I studied in Germany before. But I've been back in Germany for a year and a half or so now. Um, and yeah, so
That's really
it's been a long
amazing.
journey.
So is that a reason why you are in this mental health domain and you didn't go the, let's say, very typical path for a neuroscientist, which is more research oriented towards just brain and not towards the psychological aspect?
Yeah, very much so. I think when I was uh, deciding what career path to choose, I was really interested in mental health and the brain, and I was kind of experiencing some issues myself, but didn't really know. I hadn't received any therapy or anything, or any formal treatment by then. But I was also interested. I was also curious just about the idea of mental health and how it's treated in society. Something that's always really interested in me is like the historical changes in how we perceive mental health,
Yeah.
how we use the words crazy or sane or madness and things like that, how those have evolved over the years. And then initially, I had my first job in mental health was working in a acute psychiatric ward, a closed one. So it was all people in the UK who were fixed by the Mental Health Act, so they couldn't leave the ward. They was really in a very severely ill state, and that was
Okay.
really shaped that interacting with those kinds of people. I'd never seen or experienced anything like that, or interacted with anyone who's really that severely ill. A lot of the people were suffering from psychosis, and different and personality disorders, and yeah, that really shaped a lot of my future decisions. And then I kind of realized that personality wise I wouldn't be a good therapist, so that pushed me down the research road.
Yeah, but that's
Yeah.
actually very commendable. I have to say that going through
Thanks.
the journey and then actually contributing to the cause and having a, let's say, vision behind your work is really amazing. Kudos to
Thanks a
you.
lot. Thank you.
Uh,
Thanks.
I have prepared some questions based on your field of interest and research, and we will make sure that it's non-technical so that people can understand. Because very frankly, I have to accept here that I myself before this session wasn't very prepared about what really cognitive behavior therapy is. That's still not very common. People generally use psychotherapy as the common word. So, okay, my first question would be, what is cognition, and can you give a very layman example for it, basically?
Yeah, sure. So cognition really, to give a very general broad term, it's really all of the mental processes that we need to perceive, process, and interpret the world around us. And it can mean many different things in different people's in different contexts. And I come from a background which is quite grounded in a specific field, subfield of psychology called cognitive psychology. And what cognitive psychology originally set out to do was to try to understand the mind as a system of different processes. Um, and one classic example of that is a model of working memory. So it's really trying to break down how working memory works and looking at all the different sub processes that our mind will go through to actually for that to happen. And other cognitions can include attention, um, learning and decision making, um, perception. It really can cover a lot of different things, but in a
Okay.
very functional, operational way.
Mm-hmm. So basically, cognition processes means all the processes our brain goes through. It can be storing memory, accessing memory, learning, and all these different characteristics, you mean?
Yeah, it could be really. It's a really broad. It really covers almost everything.
Okay.
So often one distinction is
Okay.
made in terms of all the processes is cognitions, which are kind of cold, and emotions, which are kind of the hot side of processing. So those
Okay.
together really make up everything that we use in our minds.
Okay, so even feeling angry, feeling agitated, irritated, having difficulties in learning, speaking, understanding, unable to make decisions quickly, all of this can be characterized as cognitive processes.
Exactly, yeah. So you'd have emotions on one side and cognitions as well, and they
Okay.
interact with each other, but they're kind of dealt with in, yeah, they dealt with in different parts of the brain,
Yeah.
and they deal, yeah.
Okay, so regarding this, I have one more question. Then, can we control our processes? Because generally, we've been, as common people, we think that this is what we have and this is what we are born with. Can we change that? Can we change our learning capabilities, our reading capabilities, and especially our memory? Because that is, I think, everybody wants to do. They want to increase their memory so that they
Yeah,
remember everything they've ever gone through.
sure, yeah. I mean, we very much can change our cognitive abilities, and I think we'll talk a bit more about cognitive behavioral therapy, but that's really what it's based on. It's based on the fundamental assumption that we are able to
Okay.
change our emotions and our thoughts and our thought patterns through exercises and training. Yeah.
Perfect. So that's actually my next question. What
Yeah.
is cognitive behavior therapy? And how is it different from a standard psychotherapy where we talk to the therapist?
hmm So cognitive behavior was a relatively new school of therapy. It was started in the US by Aaron Beck, who kind of took this this field of cognitive psychology that I was talking about and thinking about the mind in as a series of processes. Um, you could kind of draw a flow chart of what the brain, what the mind goes through
Okay.
when someone is having a panic attack, for example. And so so Beck originally created this model related to anxiety, where there was this kind of loop
Okay.
of thoughts and physiological changes. So you would initially, when someone is experiencing anxiety, they might have some negative thoughts about a particular situation they're experiencing, and that would lead to them maybe raising their heart rate would increase, their breathing would change, um, and then they would then get these feedback signals through their body, and those physiological feedback signals could feed more into the negative thoughts and create more anxiety, and you create this kind of loop where your thoughts are kind of driving your emotions essentially in these physiological responses. And what CBT or cognitive behavioral therapy tries to do is really try to um, tap into those thoughts so that you can identify um, which thoughts are creating the emotions that you might be experiencing, and then trying to really change your perspective essentially on these thoughts, or providing alternative thoughts so that then you can have more healthy emotions as an outcome. That's very basic.
Oh, this is very interesting. So, uh, but what would be the difference between cognitive behavior therapy and a normal therapy session?
So one really cool thing about cognitive behavioral therapy is that it's can be much more generalized to a wider population than
Okay.
more traditional types of psychotherapy like psychoanalysis. Psychoanalysis is very individualized and dependent on it's driven by the content of someone's biography,
Okay.
whereas with CBT, you can take a relatively standard model of therapy and teach it in a relatively short space of time at a low level. This is what happened in the UK actually several years
Okay.
ago. The government introduced a whole new infrastructure for CBT to provide low-level training to people who weren't even qualified psychologists or therapists, to be able to kind of roll out CBT on a much larger scale. And that also allows, it doesn't only allow it to be more general and universal, it also allows it to be more testable. So there's a lot more evidence
Okay.
that supports the efficacy of CBT and different forms of CBT, because you can standardize it, and it's in terms of doing testing it in a controlled scientific way
Okay.
makes it much easier.
Yeah, so basically, it's not really therapy, it's just like understanding your thoughts and the feelings you are having and creating a connection between the two. So it's not really like you need to have an anxiety attack to go through CBT, but you can just go through a CBT training to better understand yourself and your thoughts and the emotions.
No, actually, is therapy in
Okay.
the same sense that psychoanalysis would be considered therapy or any other kind of psychotherapy.
Okay.
And it can be particularly effective for people who experience mild symptoms of anxiety, but it can also be very useful for people who have really severe
Okay.
panic attacks, who are hospitalized,
Okay.
people with like you can modify CBT to apply to many different situations. So it's definitely a therapy, and in UK and well in almost in most countries in the Western world, it's um, it's given as one of the standard forms of psychotherapy,
Yeah,
and it's one
that's
of the standard forms taught in for psychologists.
wow, this is amazing. But I remember that in India, I had a conversation with one of the lady via the live platform. And even there, even in India, I can say for that CBT is really starting to gain more attention. And a lot of psychotherapists and therapists are kind of getting themselves aware of this model.
Yeah, yeah, it's really getting a lot of. It's been for a
Mhm.
while now. I'd say it's been getting a lot of traction.
Okay, perfect. So the next question would be, does cognitive abilities have any relation to the intelligence of a person? So when it comes to learning capabilities and when it comes to memory and vision or thought processing, basically.
Yeah, absolutely. I guess when we talk about intelligence in in more common language,
Mm-hmm.
it can mean many different things. And traditionally, intelligence has been measured with standardized intelligence tests like IQ tests,
Mm-hmm.
and those focus on really specific abilities,
Mm-hmm.
which are essentially measuring your cognitive ability too.
Okay.
So there's a lot of overlap, but it's really just the kind of conceptually the difference.
Mm-hmm.
So um, yeah, so there's also people talk about emotional intelligence, which
Mm-hmm.
is one other thing, which
Okay.
might not necessarily be your
Okay.
cognition.
Okay. So when we
Hmm.
talk about the standard IQ test and the intelligence, they have a very strong overlap between the cognitive abilities. And but the one question I would have here then is that, can we change those capabilities? Can we, let's say, improve our IQ? Can we improve these aspects?
Yeah, definitely. I think the question of whether we can improve IQ is relatively simple. That in that we can, because these standardized tests, we can practice them,
Mm-hmm.
and if you practice the test, it doesn't you can get a higher score, but that doesn't
Mm-hmm.
necessarily translate to your real life. It doesn't
Exactly.
necessarily mean that you can do better at work or you're
Mm-hmm.
better at school or you have a better memory. It's just that you've done better on this specific test.
Test.
But in terms of cognition,
Mm-hmm.
this is what's, I guess, essentially different,
Mm-hmm.
is that in the clinical world,
Mm-hmm.
a lot of mental health problems are associated with cognitive deficits.
Okay.
So, whatever mental health problem you're experiencing,
Mm-hmm.
that you might have specific cognitive problems which you can actually receive training for.
Mm-hmm.
And the idea in that context would be to try to improve your daily functioning
Mm-hmm.
so that you could so that you can get a job again, you can make
Mm-hmm.
friends again, get back to a normal life again.
Mm-hmm.
And yeah, so those things in the clinical sense are more, it's more a kind of therapeutic rehabilitative tool
Mm-hmm.
when you're defining cognitive ability
This is
and
really
training.
amazing, because this actually means that we can, uh, with, let's say, validate why we are having anxiety, and this is because there is a lack of dealing with some cognitive processes, and we can work on those and take those training to improve. So there is now, for the past few years, some scientific research which is validated on this platform.
Hmm. Yeah, absolutely. There's there's a lot of cognitive training tools out there, and I think you can definitely show improvements in certain cognitions. Um, but at the same time, there's still this I guess in the research field,
Mm-hmm.
there's often this question asked, well, okay, they can improve. You can do training and improve
Mm-hmm.
your scores on a particular test, on a
Yes.
working memory test or an
Mm-hmm.
attention test. Um, but then the question is always, well, what does that really mean? What does that mean in the real world?
Mm-hmm.
How does
Yeah.
that generalize
Yes.
to, so that's really the biggest challenge, I would
Challenge, and
say.
actually the biggest goal as well, because the
Yeah,
test is not really the validation you might need. The validation is to basically deal with the day-to-day world and life.
exactly,
Correct.
exactly.
So then the next question would be, is this concept biological or just psychological?
It's definitely a mixture of both.
Mm-hmm.
Um, Now we are in the last few years, especially with the advancement of neuroscience,
Mm-hmm.
neuroscientific research, and my I really I've spent a lot of my research career doing brain imaging, MRI, EEG, and such,
Mm-hmm.
and where we're looking essentially trying to understand how biological processes in the brain relate to our behavior and our cognitions. And the main question that I've been asking throughout my research over the years is, what are the cognitive impairments in mental health issues, and what's going wrong, or what's going on differently in the brain
Yeah.
that's creating these cognitive deficits that leads to functional problems in people's lives. So there's definitely that's the biological aspect, and certainly the psychological aspect in terms of development is really crucial. And a lot of people who suffer from mental health problems, they might not get diagnosed until later on in their life. But when you look back at their biography, you see that often they might have experienced some problems at school, or some attentional problems, some problems making friends, or some abnormal kind of functional things going on. And so this kind of cognitive training, I guess, we get through our development in like a healthy kind of environment where we have good social interaction. You know, we're not experienced to trauma, and we have you know, we're not malnourished, and these kinds of things that we experience throughout our development is kind of like cognitive training in a way, where we are where we're developing our cognitive skills that we use later on in our lives. So
Okay.
if there's some abnormal shift in the in this kind of training or this development of our cognitive skills early on, then this can lead to problems later on in life. So that's
Okay.
more the psychological, I guess, environmental component.
So it's really a mix of both the biological aspect and as well as the psychological training, as you said.
Yeah, and there's definitely an interaction, a strong interaction between both. Yeah.
Okay. So the next would be, what is the connection between the cognitive capabilities and our mental health? So can you give us a few example, like kind of really dissect this part, that anxiety means lack of this capability?
Yeah, sure. So one thing that the US has been trying to do is really move away from these diagnostic boxes.
Yeah.
So when you talk about what we think about anxiety or depression, or even schizophrenia, these are really broad terms, and they're very heterogeneous classifications. So within someone who's diagnosed with a major depressive disorder, could be, you know, completely unique in terms of how the problems they have in their lives, the emotional issues they experience, the functional problems, and the cognitive problems as well. But you do see some typical patterns um, across diagnoses where people with depression is often characterized by a lack of motivation, and also a lack of the ability to experience pleasure in the same way that we maybe had done in the past. And so that is really related to the reward system in the brain. And so the reward system in the brain, that drives our decision making and our learning processes. So in depression and also in schizophrenia, actually, the reward center is, if you look at imaging studies, you see the abnormal activations. And so then this often leads to abnormal learning and abnormal decision making, where, for example, people with schizophrenia, they have trouble just learning from rewards. And people with depression as well, they don't experience the rewards in the same way that someone who's not depressed. The value of things that they experience in their life will be much less. So then, if the value is less, then there's much less meaning to the things that we interact with in our environment. So then it kind of makes it much harder to learn from things where we don't, if we're not really gaining pleasure or getting any motivational drive
Mm-hmm.
to, and yeah, there's lots. I've also specialized a lot in social cognitive impairments,
Mm-hmm.
which has a very direct relationship to how well people are able to function in their lives,
Mm-hmm.
like how good people's social networks are,
Mm-hmm.
what the kind of relationships that they have, and that has such a big impact. It's such a
Mm-hmm.
huge central part of our lives and our
Mm-hmm.
mood, our happiness,
Mm-hmm.
and people with schizophrenia, and also people suffering from depression and anxiety. Certain um, processes of social cognition
Mm-hmm.
are abnormal,
Okay.
and that can lead to social isolation, social withdrawal,
Mm-hmm.
and even like a real fundamental impairment in being able to understand other people's emotions and also your
Okay.
own emotions.
This is very interesting actually, because right now we always talk about I have depression and anxiety before the lockdown, and I think even in lockdown have become very common and trending words which people like to use very often. But there are actually like impairments, as you said, associated with these mental health issues, and people have difficulties socializing and coming out. So generally in these mental health issues we always say that you should talk it out, but I think that is not the first step. That is, I think, the last step towards, or maybe somewhere halfway down at least, because as you said, social impairment is the biggest challenge, I think, which people under depression and anxiety face.
Yeah, absolutely.
And when you said you mentioned that depression is because there's a lack of motivation, so anxiety is also because there's a lack of motivation, or is that something different?
No, it's quite different. I think anxiety is more, I would say, talking in neuroscience or
Mm-hmm.
cognitive terms. You were talking, we talk more about fear, um, and so anxiety is often characterized by yeah, a dysfunctional, abnormal process, fear
Mm-hmm.
reactions to different
And this
environmental
fear can
triggers.
be associated the fear of life or death, and the fear of failure, or as a matter of fact, any failure. Because I think, especially with the youth, it's more about the fear of failures. And as we get a little old, then it comes the fear of life and death, and then we start having these anxiety attacks for our near and dear ones, basically.
Yeah, absolutely.
Mm-hmm.
And yeah, we could also experience like the experiences we have on a day-to-day basis
Mm-hmm.
can also shape how scared we are of certain things. Like if we're when we were a kid, if we were attacked by a dog,
Mm-hmm.
um, we would generalize that rule to every other dog. Maybe later on in our lives, and we'd
Mm-hmm.
have a fear of dogs,
Yeah.
and that's relatively benign. If you think about like PTSD
Mm-hmm.
for people for war veterans who have seen really terrible,
Yeah.
terrible things during war,
Mm-hmm.
and then they return back to civilian life.
Mm-hmm.
It's very, very hard to adjust, because all the experiences that they've had are
Mm-hmm.
with people,
Yeah.
and then they return back. People who are confrontational, aggressive,
Mm-hmm.
violent, but then they return back to a non-violent
Yeah.
society, and it's just really that's a more severe problem. That kind
So, I'm going a little off script now. So, with
of.
regards to the fact that these fear and the lack of motivation, like we talked about, can be the cause behind anxiety and depression. So this is not a short term anxiety or a short term fear, or short term, let's say, lack of motivation, that I lost my job and in 1 month, or let's say in a week, I've started having anxiety. Is it possible, or is it a very long term thing that there wasn't motivation when we were students as for exams, and then it came down to job?
Yeah, that's a really good question. So it really depends, like you said, on how long the effects last for.
Mm-hmm.
And there's very normal and very healthy reactions
Mm-hmm.
that we have to certain life events. Like you said, if you lost your job or if you lost a loved one,
Mm-hmm.
it'd be very normal for you to grieve,
Mm-hmm.
to be upset, to have negative thoughts. But then if these start to become pervasive and continue and start to limit your ability to do stuff,
Mm-hmm.
to find a new job, or to develop a new relationship,
Mm-hmm.
or um,
So you
if it
were
has
just
an
happy again and let your body take its control.
yeah, exactly. Then it would be, once it starts becoming a problem functionally, then then you would start to think about treatment, and in that
Mm-hmm.
case, then you would be given a diagnosis, maybe when you would go and see a doctor,
Mm-hmm.
but the diagnosis is only given to allow for treatment.
Mm-hmm.
Essentially, the diagnosis it doesn't necessarily it's not a clear cut marker that you have crossed a certain line
Exactly.
necessarily.
Mm-hmm.
So it's really just that, okay, now you've accessed the healthcare system and
Mm-hmm.
we need to provide you with treatment,
Mm-hmm.
and we've got several different routes of how we can treat people
Mm-hmm.
with mental health issues.
Mm-hmm.
And the easiest way to handle that is to categorize people with these labels,
Mm-hmm.
and then we can then follow a path according to that label,
Mm-hmm.
that might be a kind of stereotyped model of what
Mm-hmm.
depression might be.
Mm-hmm.
So yeah, I think that's
Yeah.
really it can be a problem, I think,
Mm-hmm.
because the whole diagnostic labels is really for clinical purposes.
Mm-hmm.
But then once you label yourself as
Mm-hmm.
having depression
Mm-hmm.
or having anxiety, there's all these prejudices and
Mm-hmm.
stereotypes and other labels that come
Mm-hmm.
along with it that you maybe have
Yeah.
built up over your
Mm-hmm.
life, and then you get this stigma associated a lot with these mental health issues,
Mm-hmm.
and which is a shame because it really um, a lot of the prejudices might not necessarily be true,
Mm-hmm.
and these labels are really just there to allow for doctors to be able to make
So,
clinical decisions about what to do in
yeah.
terms of treatment. Yeah.
Mm-hmm. Okay. This is
Mhm.
actually very very interesting. So one more question of the script. So can do you think that neurofeedback, when used by people, they can in neurofeedback can we actually see these cognitive processes being improved?
Yeah, absolutely. I think I'm not too sure. I don't know so much about your technology, but I've worked a lot with EEG before.
Yes, exactly. Each.
Yeah, and one like I've worked with a few different signals with EEG, which have been thought to relate to different cognitive abilities and different mental health issues.
Mm-hmm.
Um, and yeah, for example, um, one common feedback signal with EEG is this frontal signal that is supposed to be a kind of signal of our attentional capability that we can
Yeah.
train. And one other one that I've worked a lot with in depression is called the frontal alpha
Mm-hmm.
asymmetry, and that essentially is looking at this balance of activity in two sides of your brain, the frontal part of your brain, which is thought to relate to more emotion processing.
Mm-hmm.
And people with depression have a certain shifted in one way,
Mm-hmm.
in terms of the balance of the the power of activation,
Mm-hmm.
compared to healthy people.
Mm-hmm.
Um, and when you give treatment, when you give psychotherapy or medication,
Mm-hmm.
you can see this shift back to a more normal kind of asymmetry, and that also comes with a shift, an improvement in cognitive abilities often. Um,
This is really interesting. So we can actually like because for I understand this aspect, at least this part, but for the audience, it's more interesting that there is science to kind of validate that there is improvement in our memory, there is a shift in, let's say, the activity in the different lobes and the different regions of the brain, which actually can be used by professionals to help them actually and diagnose them basically.
Absolutely, yeah.
Perfect.
Yeah, there's several. Yeah,
No,
sorry, I
no, no.
could go
Yes,
on, but it's
please.
okay. So one example, which is really cool, that I is more in the field of schizophrenia, especially people with auditory hallucinations.
Mm-hmm.
There's been some work for a while using real-time fMRI feedback,
Mm-hmm.
um, looking at activation in the auditory cortex,
Mm-hmm.
and having people imagine the voices or hear the voices that they would typically hear, and also get feedback on their own voice,
Mm-hmm.
and it can help kind of retrain the brain to um, no longer kind of misinterpret these auditory signals that are in the brain, and so that they're not labeled as an external voice,
Mm-hmm.
as people with auditory hallucinations do
Okay.
experience.
Oh,
So
so
yeah.
this is interesting. I have now questions about this, what you said.
Oh
So,
yeah, sure.
so basically, you're saying that generally there are voices inside our head, and when a person has auditory hallucinations, it's perceived that these voices are coming from outside, whereas they are really coming from the inside.
Exactly. Yeah,
Oh.
yeah. So you can use neuroimaging feedback
Mm-hmm.
to retrain, yeah, the auditory cortex to
Mm-hmm.
then, yeah, shift the kind of ownership of this voice
Hmm.
back to your own.
Okay. So we
Yeah.
can actually train our brain if even if this happens, there are, let's say, science and research to show that and to train our brain to see and shift the balance to our own brain and make our brain understand that this is not coming from outside, it's really our brain, and actually make the
Exactly.
person um, believe this again. I don't want to say the wrong
Yeah.
word.
Yeah. No, that's certainly, yeah. I think that's totally fine. Yeah,
Perfect.
absolutely.
So, are there any cognitive behavior modeling techniques to improve these issues? And these, I mean, anxiety, depression, sleep issues, some techniques which you can tell, which people can use at their home basically.
Mhm. Sure. Yeah. Yeah. As I've been through a lot of mental health issues myself and
Mm-hmm.
been through therapy, as I'm a scientist, actually,
Exactly.
uh, being given therapy which is very rational
Mm-hmm.
and structured and logical
Mm-hmm.
is, for me, very beneficial. It doesn't
Mm-hmm.
work for everyone, but
Mm-hmm.
cognitive behavioral therapy methods are very much often kind of logical and rational and
Mm-hmm.
structured. So CBT has been relatively effective
Mm-hmm.
with me.
Mm-hmm.
But I've also practiced mindfulness a lot and found that very helpful.
Mm-hmm.
And so one technique actually that I found to help me manage my emotions,
Mm-hmm.
because when I'm really not feeling well and I'm run down, I haven't slept well, and I'm having lots of negative thoughts, I can often ruminate, which is one of the very common symptoms where in depression, where you start a negative thought and that leads on to another negative one
Yeah.
and another one and another one, and this you end up in this kind of spiral
Really, yeah.
down into this black hole,
Mm-hmm.
basically,
Mm-hmm.
where when you're really unwell, it's really difficult to pull yourself out of.
Okay.
And so one method that I've really found useful, that my therapist had taught me, is, well, firstly, just practicing mindfulness so that I can kind of catch myself
Mm-hmm.
at that first step down the spiral,
Mm-hmm.
to have the awareness of my emotions and my thoughts,
Mm-hmm.
so that then I can kind of have the ability to reflect and say, okay, this is a negative thought that I've been having. I've had this before, and this is very familiar to me, and I know this is not me. This is my depression. Um, and then one really cool technique I learned to follow on from that is to really visualize your emotions in the physical space, in your own physical space, which is something which I could kind of do. You can kind of do anywhere as well, um, where you can imagine yourself in standing in one spot, and on one side is the spot, is an area which is the kind of negative emotion that you might typically feel, like anger or worry or anxiety that might be created from these negative thoughts. And so you could choose, like by stopping and saying, okay, well, I have this choice to go down that route, which often happens, and then I end up going down this spiral, is the unhealthy route or this unhealthy spot. Or I can have an alternative. There's another spot in front of me to my right hand side, which is me actually saying, well, no, this is not the truth. This thought is not the truth. It doesn't reflect really what's going on. This isn't me. This isn't a helpful thought. And I've had this thought before, and I know what's going to happen next, and I don't want that to happen. I don't want to get angry, and like shout at someone or express my anger. So then by visualizing it, for me it creates this really nice.
The last section of my life is where I ask you to share a story. It can be of yourself or some person you've very closely observed, where these techniques, cognitive behavior therapy, has been life changing for people. It can be a very casual anxiety attack, or it can be even serious issues. So just a story which you want so that people can relate to and understand
Mhm.
how these small cognition processes which you have mentioned can help us be a better version of ourselves.
Hmm. Um, yeah, I guess I used to work in a rehabilitation center that specialized in dealing with people with severe brain injury, and there many of the people had experienced some kind of traumatic brain injury, often from a car accident, or some kind of accident where they've had some impact on their head. And there, the cognitive training aspect was really much more central to the rehabilitation. And so there was people who had lost their ability to really maintain their working memory. Some people could couldn't remember. They didn't have a working memory of more than 20 seconds or so. But at the same time, they were able to remember a lot of things from their before the accident. Um, so there, I was actually, my responsibility was to do the training actually with these patients, and it was really difficult, because there was massive biological changes in these people's brains through the damage that had been caused by the accident. So the loss of function was really, really severe. And often it was the case that they had to really try to make like plastic changes in their brain, like take advantage of neuroplasticity and be able to utilize other parts of their brain that were intact to take over the function of the parts of the brain that were damaged, right? So that was really like you're not just overcoming like this motivational and time challenge of like training that all of us experience, but in addition to that, you have this biological barrier, and so yeah, I did see changes, for sure, and really astounding ones where, um, for example, a patient, um, he would remember his family because he could remember a lot of the events that happened before the accident about his biography, but there were several friends, close friends, that he didn't remember, because their friendships became much later in their life, in his life, and so his friends would come and visit him, and he wouldn't know, he would have no idea who they were, and this was heartbreaking for really, really close friends who were taking the time
Yeah.
to come and see them, see this guy, their friend, who maybe he'd known for many years, um, And so there was one situation where I was doing training with the patient who had a particularly bad impairment in his working memory, and he was a heavy smoker.
Mm-hmm.
And I remember I tried to time actually how long his memory capacity was, and I think I got like 20 to 25 seconds at one point.
Mm-hmm.
Um, and so often he would we had to ration cigarettes to them to their patients so that they just didn't smoke too much, especially for this guy, because he would smoke a cigarette, and once he was finished his cigarette, he had immediately forgotten that he just smoked a cigarette, and then he would want one straight
Wow.
after, and then he would then he would then ask the nurses for another cigarette,
Mm-hmm.
and that could go on, throughout the whole
Exactly.
day. So, but yeah, so I was doing training with him to try to improve his memory and doing lots of exercises, and it
Mm-hmm.
was really intense. They were in the hospital 24/7, so I was there like um, yeah, a couple of times a day, every day, doing
Mm-hmm.
training with this guy.
Mm-hmm.
And I remember at one point, one of his friends came to visit,
Mm-hmm.
and they were talking, and there was still this lack of recognition. But then
Mm-hmm.
the guy said something that kind of made him realize that, oh, actually, I know this person.
Wow.
And his close friend realized that. And it was just such an emotional moment for both of
Mm-hmm.
them to like have this breakthrough.
Mm-hmm.
And so people with who suffer really severe brain injury,
Mm-hmm.
they can rehabilitate themselves
Mm-hmm.
through cognitive training to kind of regain some of their cognitive or a lot of their cognitive functions. And yeah, this is just one example of
Well, this is such an
something really silly.
inspiring and motivational example. Like, if a
Mhm.
person who's gone through so much and has a brain injury can actually gain that skill, then let's say we as common people having just day-to-day difficulties with our task can definitely do so. It's very
Mhm.
motivational and inspiring. It's I love the story part. Thank you so
Yeah,
much for this story.
you're welcome.
So, thank you so much, Elliot, for joining us on our platform. I would like to tell our guests that the video will be uploaded on our website www.neuphony.com. It will be there on YouTube, and all the upcoming events for every Sunday for the coming month are also there on the website. The link will be mentioned down in the comments section. Thank you so much, Elliot. Thank you, everybody, for joining us.
Thanks for having me.
Thank you. Bye bye.
Bye.